While over half the U.S. population has received at least one dose of the COVID-19 vaccine, short supply in other parts of the world means the global fight against coronavirus is a long way from over. We want to bring in now the director of the World Health Organization's Department of Immunization, Vaccines, and Biologicals, Dr. Kate O'Brien. Dr. O'Brien, thank you for being with us on GMA3. And look, we've had a lot to celebrate here in this country, reaching some milestones, getting more people vaccinated. There are issues other parts of the world. Where should the extra doses be going right now?
You know, around the world, the highest priorities are to immunize healthcare workers and those people who are at highest risk of severe disease and death. And that largely means elderly populations around the world. We have only one mechanism to distribute doses around the world on a fair and equitable way, and that's the COVAX facility. So where any country has doses that they can share, and the COVAX facility is also procuring doses, that's the way that we can get doses where they're needed most and when they're needed.
Now, you are the technical lead for the COVAX, the UN-backed global vaccine distribution effort. But President Biden has said we at least some 80 million surplus doses the U.S. is going to distribute around the world. Do you think you all are better equipped, right, versus the United States or some other country making the decision for where they think they should go? Should this be a singular effort?
We do have a way to be sure that the doses are going where they need to go, when they need to go. When countries individually try to decide that, it's a little bit more herky-jerky. So we really think that the COVAX facility is the way where the world has come together and has really empowered WHO and the partners that are in COVAX to make those decisions. And it's a transparent and fair way to do it.
And Dr. O'Brien, we're not facing a shortage of vaccine. We are facing an issue of getting it to where it needs to go. That seems to be a shame.
Well, the shortage is really about timing. As everybody in the United States knows, at the beginning of the program in the U.S., it really was about were doses in your community at that particular time. And this is the issue around the world. We have a projection that there will be more and more doses coming, especially in the latter part of 2021 and certainly into 2022. The issue is right here and now. And there are numerous countries, many high-income countries, that have a large number of doses. The estimates are that for high-income countries in 2021, there will in fact be 1 billion extra doses that are in excess of what is needed in those countries. So what we're really calling for right now is for countries to start sharing their doses now that are especially far ahead in their programs and are seeing the impact of vaccines. There's so many countries where even the healthcare workers, those who are taking care of people who are sick of all different diseases, haven't yet been protected.
Hey, Dr. O'Brien, you just said you're urging countries to start sharing their vaccines and their surplus now. Why aren't they?
Well, we think that countries want to do this. We know that there have been commitments for doses that are over 100 million doses have been made already. And really it's about the urgency of this timing. Manufacturers can help with this. There are contractual arrangements, the contracts that are in place. And we need really to see the commitments of countries releasing the doses at this point so that they can actually be deployed.
Okay, last thing I want to ask you about here, you all are going to start using a different naming system, if you will, for some of these variants. I can't keep them straight. B1N7, B12. I can't keep all the numbers straight. So you're going to start using the Greek alphabet to name some of these variants. Just as a matter of helping us keep up and speaking in a colloquial way about variants is helpful, but why is it also helpful that we are not now kind of shaming some countries for where the variants may come from?
Yeah, so the scientific numbering and naming of variants, it's just not a very easy way to talk about them in conversations like this. So we do need a more simple way, and because the scientific naming system has been complex for people to remember, people have reverted to referring to the variants according to where they were first identified. But really, it's not a relevant way of naming things, and it does stigmatize places around the world. So we really are reverting now to using the Greek alphabet And when we use up all of the 24 Greek letters, we'll go to another naming system for additional variants of concern and variants of interest. It really is about, let's refer to them about as they are variants. And because they are spreading around the world, referencing them in the place where they were first identified really doesn't have much meaning and creates stigma.
Yeah, B16172 doesn't really roll off the tongue, so let's just call it Delta from now on. Dr. O'Brien, it's good to have you back. I know you are at it, and you have been at it during this pandemic and doing that work, so thank you so much for spending some time with us, and we'll see you down the road, okay?
Thanks for your time.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.